have facilities that have mental health departments. And therefore, I would be seeking, first of all, is an integration of mental health in primary healthcare. That the community health workers that was talked about earlier, then when they go to a family in terms of looking at their health, one issue would be screening for mental health. That then we are able to know who are these who have mental health issues. While they screen for them, then they move them through the levels of healthcare, level 1 to level 6 if need be. But most importantly is integration. Because mental health is like almost the basis of everything. Even for one to be socially fit, you have to be mentally fit. For one to engage in economic activities, members and through the chair, you have to be mentally fit. So I'll be seeking that. But again, of important is that mental health has been neglected. And it's because of the stigma and this discrimination that is around mental health. Actually, in this country, if a patient is referred to Mathare Hospital, many people will be running away from that patient saying, "Huyo ni mwenda wazimu." Yeah, so the first thing that we are going to do is even to rebrand Mathare Hospital, so that then people don't start seeing you as a mwenda wazimu once you are referred to Mathare. Maybe we'll give it a better name. Yeah, so that then that is not there. Honorable Mishi, you are worried about counterfeit drugs. While working at Mission for Essential Drugs, before listing a drug, it had to go under rigorous lab testing. And I believe the laboratory at Mission for Essential Drugs is the biggest in terms of quality control checking on pharmaceuticals. Not even the National Quality Control Laboratory is to that extent. So I am aware that we have institutions in this country, that is the NQCL, and through partnerships, public-private partnerships, then some drugs can be checked. Not even some, actually all of them, at the point that they are being enlisted on the Kenya Essential Drug List. They should be checked and determine that the molecule are good enough for human beings. And also the Pharmacy and Poisons Board has to step up in terms of what they do in registration of drugs, the rigorous exercise they undertake, the good manufacturing practices that they check before drugs are allowed to be registered. Thank you. And Honorable Daud, thank you very much. You said you have brought to the House a cancer bill and a health amendment bill. And your concern was the public health in terms of those two issues. So public health is under the Schedule 4, of course. In terms of policy, then it remains at the national level. But in terms of implementation, then it is at the county levels. And as I had said earlier, this calls for collaborations. And Chair, in this country, we are not short of regulations, but we are short of implementing the regulations and the good things that have been put in books. So I am seeking that if this committee approves me and eventually I get to be the CS, is that we shall not now spend a lot of time in developing policies and documents, but we look back and now implement that has already been developed. Honorable Kosing, your concern was regarding staff, and you spoke of ghost workers, that the new governments have, the new governors, most of them are regarding the existing professional workers in the hospitals as ghost workers. I do not have a direct answer to that because when a new administrator arrives, they have their style of doing things. But mine is just to say that everything that is done, it should be within the law and regulations must be followed. That then they are not just arbitrary, saying people are ghost workers, but instead they are checking whether they are properly recruited and if they merit for their positions. You spoke about traveling.
Chair, I think the nominee, what I was looking at is not for you to administer the governance, is what do, at the national level, you need to do something at the national level that will be able to manage even the staff. As you said earlier, in Trans Nzoia, if you have overstaffed or overstaffing in Trans Nzoia, that those technical staff can even go and help with Pokot. It's about the same thing, so that those the health workers are not controlled by governors. Because if a new governor comes in, very sure, he's going to send the old ones which were employed by the former governor because they think that they're politicians, right? So they politicize the health sector. I want you to come with a radical knowledge of depoliticizing the health at the county level from the national, so that at least we have these people permanent or so that they can serve the people, not be changed at will of a governor. That's what I meant.
Chair, Chair, my question was not answered.
To my understanding, the CS Health has no jurisdiction over employees of the county governments. The only thing that is been debated over and over is whether we have a health workers commission that will then bring on board health workers from both levels of government, the way we have teachers, and then manage it. But that is now within your purview as legislators.
Chair, my question regarding, would you consider as the CS, if you are nominated, taking over some of the level 5 and level 6 hospitals where the...
Honorable Dawood, who has given you the authority to ask another question? If you finished that batch, I want to give another batch. Naisula, Gikaria, Mule, Nyikal, Emase. Everybody will have a chance.
Thank you, Chairman. And to the nominee, Susan, one of the reforms that NHIF Amendment Act of 2002 did was to cure the disparity in terms of NHIF reimbursement. You would find that private hospitals get more than the public hospitals, and also still having in mind that most public hospitals are devolved. But how would you work in collaboration with the counties to see that we improve our public hospitals so that this money, NHIF, will then be paid to our public hospitals so that then Kenyans can affordably access healthcare in the public hospitals instead of just enriching a few people in the private sector? And your thoughts on the split of Ministry of Health into the two departments? What are just your thoughts, and what would you think was the thinking behind it?
Vicaria?
I'm just going to read a question which has been sent by a colleague from Nakuru. It says, kindly ask her what is her take on the adolescent young people sexual and reproductive health policy, as well as the launched national reproductive health policy that did not go through public participation process. Yet we have so many cases of teenage pregnancy, new HIV and AIDS infection among adolescents, and finally the reproductive health bill in the Senate and your intervention to involve the Kenyan government on the reproductive health bill in East African Legislative Assembly. And secondly, is about these infamous containers. It's about the containers.
If you convey your constituent's question, you forfeit your own.
Okay.
I'll indulge you, but if you convey a question from a person who is not in this room, then you surrender your right to ask your own question so that we can make good progress.
But you've given me...
I've indulged you, yes.
Thank you, and I know that's why my vote went to the right place. To my dear sister, the infamous containers which were brought or bought by the former regime, and they landed at Mombasa at the port. I don't know whether they were taken out to the Naivasha inland place. I don't know what is their case. I've never followed after that. Thank you. Thank you, Chairman.
Chair, just
yes.
1 minute.
Maisula?
Yeah, I just wanted to correct something because we are on Hansard. I said that it was the NHIF Amendment Act of 2002, while I meant to say of 2022.
And
2022.
Okay, it's corrected.
Thank you very
Mole.
much. Thank you very much, Speaker. Having coming from the health background, I believe that the health sector will be in good hands. That's one of my confess, because of the actual knowledge of this industry. But my concern is very clear, and it runs across board, whereby Honorable Mbui came on board to request on your thoughts regarding GMO. But I want to go to specific. How are you going to integrate National Quality Laboratory, the lab being used by Kenya Medical Laboratory Board, and the Pest Control Board to give a total solution of any product coming into the country for registration and be used for human treatment in this country? And why I'm asking this, and your thought is, we are aware of the tussle between the National Quality Laboratory Board laboratory and the Pharmacy and Poison Board. And if we allow GMO to come on board, I'm very sure you'll find the tussle you are being asked to send those samples to Pest Control Board. It's a highly technical issue which probably, if you don't have an answer, think about it as you get into the ministry, if you are approved, to make sure that we safeguard the life and the safety of 50 million Kenyans going forward as you take up this docket. Thank you very much.
Dr. Nyikal, the friend of the committee, within the confines of your request.
Thank you, Mr. Speaker, for giving me the opportunity and also allowing me to attend this vetting. May I take this opportunity to congratulate the nominee and also appreciate the knowledge that she has. Mine is a fundamental issue. All said and done, what has been agreed is that Kenya, like or many other countries, to move to universal health coverage. I know many of us may not even know that the concept actually originated here. That's for another day. And we have agreed that this will be done in the context of universal, with the social health insurance as a funding mechanism. So my question is, all this good information you have, what is the roadmap, step by step, that you intend to put in place to get all these together? All these are in bits, but it has to be together for the people to benefit and get health services at a cost they can afford and not paid for at the point of delivery of care, particularly in emergency care. Many people die because when at time of emergency care, people are waiting that they pay. And how are you going to face the challenge? How are you going to address the challenges? Some you have addressed very well, to my mind: the human resource, the procurement, the cost, the component are drugs, the hospitality, the professional costs, and the cost of equipment. How will you put that together, particularly the professional cost, the cost of drugs? And this is in the context of a devolved system where the policy you evolve are national, but you're going to implement them at the county's level, where you will find that sometimes the authority is not there. I noticed that a department has been created of standards But you also mentioned in the Constitution there is intergovernmental relations structures. So those, to me, that broad issue, if you can get over it, I would be most grateful. And just brief us on it.
Thank you, Mr. Speaker. Mr. Speaker, my concern goes to how the nominee is going to improve service delivery to the level 2, 3, 4 hospitals, especially in rural areas, because majority of us represent constituencies in the rural areas. And my attention is drawn to the issue of conflict of interest that exists between the private practice and public practice by health professionals. Mr. Speaker, you will find that the health professionals have given priority to their private practice vis-a-vis public, to their private practice vis-a-vis public services, despite the fact that they are civil servants. And sadly, you will also find that even the medicines that are procured in this county, in our hospitals, they end up disappearing. And when patients go and they're given prescriptions, again they are directed to pharmacies that belong to some of these very professionals. So I'm wondering, what is the nominee going to do to ensure that you improve on service delivery? And finally, even on the issue of equipments that have been distributed to these hospitals, some of them have not been operationalized because they do not have the right personnel to execute the task. So, Mr. Speaker, we lose so many people. Our mothers go to the nearest health centers, they cannot get the required services, they are referred to the county hospitals, they are referred to the national, they have no money for an ambulance. In the process of trying to solicit funds or seek for support, we are losing an expectant mother. We are losing an innocent child. So, can you tell us what you're going to do to address the challenges that are facing our health sector? Thank you.
You can take on those before we take another batch.
Thank you, Chair. And thank you, Honorable Naisula. And as you rightfully put it, in the act that NHIF is now sending more funds in terms of reimbursement to private hospitals vis-a-vis public hospitals. Mheshimiwa, what we should be asking ourselves is, why are people going to private hospitals? And from my training, we do what is called root cause analysis. That we ask ourselves why, up to the moment that we can no longer ask ourselves why. And from where I sit, the public hospitals are ill-equipped. The public hospitals do not have medicines. The public hospitals, the healthcare workers are not there. Therefore, as a country, then we need more of a paradigm shift in terms of what are we going to ensure, to ensure that our public hospitals are working. If our public hospitals are working, people will go to them, and the reimbursements will not go to private, they'll go to public. But now we are in a catch-22 situation. Should we stop the payments to private? Should we lose life because we've said everyone should go to public? No. So, as if this committee approves of me, then we shall be working together to ensure that our public hospitals are working through proper funding, through ensuring that institutions are working, an institution like Kemsa. If the public hospital is expecting to get drugs from Kemsa, and Kemsa does not have drugs, because they have not paid their manufacturer or their vendor, they have not paid the vendor, and Kemsa says it is because the county has not paid. Therefore, it is a cycle. So we must get to a position where we say enough is enough, and this is where we are going to begin to ensure that public hospitals in Kenya are working. Honorable Naisula, I'll be proud that when I leave, they'll say this is the woman who made public hospitals work. And that is what I intend to do.
Can I ask her something? What are you going to do about the doctors? Because, you know, most of the doctors, when they go for the further studies, and it's the government which is paying for them, if you go to Kenyatta Hospital.
Mukami, you are going to be the next online. intervention and demand no more after this.
Okay, sure. Congratulations, Susan. My concern is the doctors. What are you going to do about the doctors? Because most of the government doctors, when they go for further studies, they don't go, when they graduate, they don't go back to the hospitals. They start their own clinics. And that's why if you go to Mamarusi, you get to Kenyatta Hospital. If you go to Nyeri Provincial Hospital, there are no doctors. What are you going to do about it?
Continue, Susan.
Thank you. And Mheshimiwa Naisula, I think your other concern is the split of the Ministry of Health to have two departments. And from where I sit, I want to believe that in our Kenya Kwanza plan, we said we shall take services to the people. And therefore, this split is just in ensuring that we meet our promise of taking services closer to the people, and that the lesser a department has in terms of focus, then they are able to do it better. The next question was on reproductive health. Mheshimiwa, I didn't get your name because you seated behind, neither did I see your plug.
Gikaria.
Gikaria.
Nakuru town.
Mheshimiwa Gikaria, national reproductive health, just like any other health, under Article 43 of the Constitution, every Kenyan has the right to the highest level of health. And reproductive health is one of it. And as you rightfully put it, we have a lot of teenage pregnancies. We have HIV cases. And you're wondering what is it then that I'll be able to do in terms of involving everyone in managing this menace. So as I said, we, under the Article 43, a right to health. I am aware that there is a national reproductive health policy, a recent one, that I think is 2022 to 2030, that has just been launched, and it provides a framework on how to handle these reproductive health issues. And one of them is the teenage pregnancies. But from where I sit, it will take an approach of whole government, because if you look at these teenage pregnancies, they are occurring to school-going children. And therefore, we must have then reproductive health and sex education in schools, so that then girls are taught how to take care of themselves to avoid these teenage pregnancies. And these teenage pregnancies are occurring because of girls are getting impregnated by adults. So then we should be asking ourselves, who are these adults who are irresponsible and impregnating teenage girls? I once heard on TV someone say that in an area, if a girl, teenage, is found pregnant, they will be taken to the chief's home to live there. Therefore, it is, for me, I'll be advocating for a whole government approach in ensuring that we have sufficient and adequate sex education in both primary and in secondary schools to avoid these teenage pregnancies. And on matters HIV, I am aware that the prevalence level is coming down. The national prevalence level at the moment is at 5%, and therefore we have gained heavily from donor funding. And I'm happy that one of the organizations that I've worked with, Global Programs, is heavily involved in research of HIV, AIDS. Therefore, I'll just be seeking to build on what has been done so far in terms of managing this. I am also aware that there is a national institution, syndemic, that has been put in place to take care of HIV, malaria, and TB. Mheshimiwa Gikaria, about the infamous containers, I do not have sufficient information to respond to you. But if allowed, once I get into office, I should be able to respond to that. Honorable Mule, thank you very much for noting my, I want to believe, my suitability for this position. And it is, I think the the infights between NQCL and the Pharmacy and Poisons Board may not be known outside here, but for those of us who are in the sector, we know about them. And the issue of registration of products. We have put the mandate at Pharmacy and Poisons Board. The testing is elsewhere. So there is a confusion there. And that is why in my earlier response to another question, I said, it is high time then we moved our Pharmacy and Poisons Board to a Food and Drug Regulatory Authority. It will take care of the fighting that is in there. But as people in the sector, that is something that we can discuss further and look at the best way possible. Pest Control Board, I do not have sufficient details on that board.
Weight of information, Chair, it's a totally different. It's in agriculture.
I have a very clear mind why I'm asking this. Mr. Speaker, the moment we talk about GMO and we are talking about the safety of the seeds which will come in, and she's talking about Food and Drug Authority, I can assure you we'll have to intermarry those two departments to get the safety of this country. The challenge will be, as there is what is so-called infight on the other end of the NQLC, you still find a challenge with the Pest Control Board, whereby they don't want to be managed from anywhere else apart from the Ministry of Agriculture. We are saying this because we interacted with the Pharmacy and Food and Drug Authority bill, which had been drafted by Dr. Bukose in last parliament. And I can assure you to bring the two ministries together to agree on this, to move on the Food Drug Authority, was next to impossible.
Honorable Mule, if you've been following the developments, the new government, the new administration has brought in place a ministry headed by one of the persons we vetted here, Musalia Mudavadi, who will be coordinating those government agencies. And it will be quite easy to bring together Food and what Pharmacy and Poisons Board, Pest Control, KFIS, and name it. I mean, that's what his duty will be. And it will be very easy to, a coordinated government will have no problem doing these things. An uncoordinated government will have very difficult ways of getting things done. So let's not live with the history of lack of coordination. We are moving into better coordination. Dr. Nyikal, and I discourage you, Honorable Mule, from hijacking the floor and engaging in.
Thank you, Chair. And thank you, Mheshimiwa Dr. Nyikal. I appreciate your wealth of experience in matters health, and I understand where your passion comes from in matters healthcare. And one of the promises that we made, Kenya Kwanza government has made, and it is in our plan, is ensuring that we deliver universal healthcare. You have asked for the roadmap to this, and you are concerned about the out-of-pocket payments by the population, which is very expensive, the cost of professionals, the cost of equipment, and the cost of drugs. Chair and Honorable Nyikal, as we sit here today, you must be very lucky if you are not in a WhatsApp group that is contributing to a medical bill. And therefore, the Kenya Kwanza plan is to ensure that we take care of this. How are we going to do it? Through NHIF. And as I said earlier, that we have a population of close to 11 million Kenyans in the informal sector who are not registered on NHIF. Therefore, my plan, one of it is to start an RRI, Rapid Result Initiative, in terms of ensuring that the people in the informal sector are then registered on NHIF. How are we going to do this? Is through the county governments. I'll just take an example of my county of Trans Nzoia, that we have a population of about 1 million people. 1 million people, and in averagely, if we work with 5 persons per household, that means we have 200,000 households. These 200,000 households is easier, and I'm saying 5 people because I'm taking cautious. I know Western, there are some households with 10 to 20 people, but just for the sake of understanding, 5 persons. It will be 200,000 households. If we put this in at the community level in terms of recruitment, members and through the chair, you are aware that Nyumba Kumi is working, where matters of security are handled through the Nyumba Kumi. And therefore, if we collaborate very well with the county governments, we shall also have our own Nyumba Kumi in terms of the community health group, where such then they'll be following up in terms of recruiting people into the NHIF. And once we have majority, as insurance operates, then we should be able to take care of these people in terms of costs. You've talked of the cost of professionals, which is, I know, regulated by the Medical and Dentist Practitioners Board. However, the cost of drug is not regulated. Chair, while working for Mission of Essential Drugs, I visited India just to check on their manufacturing for pharmaceuticals. And one of the things happening in India is that any drug that is out for consumption, it has something written on it called RRP, Recommended Retail Price. And therefore, you can never pay more than that because it is in public. I know that price regulations in Kenya are not there, but with the support of the House, we should be able to get to a certain level, because these are necessities then where the cost of drugs is regulated. And if we focus more on using locally manufactured drugs for the molecules that can be manufactured locally, I believe we should be able to bring down the cost of drugs, Dr. Nyikal. I may not be able to draw for you an exact roadmap in terms of how we are going to achieve UHC, but it's clear on top of my mind that it's going to be progressive. And after some time, we shall have achieved the UHC. And Honorable Emase, you are concerned about service delivery at level 2 and level 3 hospitals. And 4. The Kenya Kwanza plan is to focus on primary healthcare, which is promotive, preventive, and rehabilitative. And once we focus on this, I can assure you, Honorable Mercy, that if we take care of the primary health, most people will not end up in hospitals. And even if they did, that we have then empowered the community health volunteers to take record of the health status of their community. Then even the referral systems will be working from one referral, from one level to the other in terms of cases that complicate. It is unfortunate that in this age and time, we talk of mothers who are dying on the road while delivering. But I want to believe that once we put in place the NHIF and we have systems that are working bottom up, we should be able to take care of these issues. You've talked of pilferage and of medicines at the local places, and you say most of these are diverted into private practice. Honorable Emase, while working at the Nairobi Women Hospitals, as a member of management, once a month, you are required to be on rotational, where you're in charge of the whole hospital. And it had many outlets. So you could be sent as a member of management to be in charge of the Rongai units. And you'll be taking care of the hospital from end to end. And one of the things was to know if doctors have clocked in and not. So I want to believe that based on my knowledge from there, this is something that we can scale up. That the doctors are not just paid a salary in public service, but there's an incentive for how many patients they have seen, actual work done. So that you just don't come and drop your jacket and leave. And I want to believe that with the recommendation that doctors are bringing of the National Health Commission, we should be able to handle most of the human resource matters around the doctors. The issue of equipment not utilized under the MES due to lack of personnel. One of the terms in the agreement was training of the personnel. And I want to believe that we shall be focusing more on this, that if adequate personnel have not been trained, then what do? We have many people who are graduating from KMTC. So it's just to ensure that these graduates then are properly deployed, and that is in collaboration with the county governments. Honorable Mukami, you talked about doctors when they go for further studies, they don't come back. From my experience, and as I informed members earlier, Chair, while working at Mission for Essential Drugs, I got a loan which I paid for my degree and master's. And one of the conditions from the loan from the Organization for Mission of Essential Drugs is that we were bound for a certain number of years. And I want to believe that works, that once you have sent a doctor, then they are bound for a certain number of years, that then, even when they come back, they're able to work in the public sector. And if not, then they make a refund of the investment that has been put in them, so that then that investment can be transferred to another doctor. Thank you, Chair.
Yes.
Clarification, sir.
Pardon?
Just small clarification from her.
Yes, Dr. Nyika.
Thanks a lot. I appreciate the response. You haven't answered the interface between the county and the national government, because you do policies, and then they do the implementation. And sometimes that does not run through. For example, when you are talking of quantification on drugs, the quantification should be done at the counties, not at the national government. So when you look at what's happening now, some counties are doing very well, particularly with infrastructure, but others are not. How will the ministry make that, using that interface, if you see how you can maybe think about it?
I will just
Chair,
take that as a positive
just,
comment. Mary, please.
Clarification on
Please.
my question.
Let me give others as well. Dr. Nyikal, thank you. I take that as a positive comment that the nominee should take into account going forward. Thank you so much. Shuria, Raso, Amisi, Koech, Ferdinand, and George. In that order. Mary, if there is time, I'll give you a minute to clarify what you want. But let others also have a bite.
Asante Chair.
Swali moja moja jameni.
Swali yangu ni moja, lakini naona kuna constituents hapa ametuma swali ama anahitaji usaidizi na
Soma ya constituent, wacha yako.
Asante Chair.
Yes.
Madam Nominee, my constituent here is asking if you're aware that most of the staff at Kemsa were sent home since November last year. And some of them had nothing to do with what was happening because they're working in departments like HR. So he's asking if you're aware of this, if you get the approval of the House, what would you do about Kemsa staff? Thank you.
Excellent discipline.
Thank you, sir. I have to take the instructions of the chair.
Well done. Raso.
Thank you very much, Chair. Susan, congratulations on your nomination. I come from Marsabit. There's something called level 5 and level 6. For those of us who have been marginalized from the beginning, I think even with devolution, we are not yet at level 4. What will be your initiative in terms of actually bringing those hospitals up to the necessary level where the population can get adequate support. When I look at your CV, a very colorful CV, procurement and supply chain manager, I don't want to speak for the appointing authority, but they have in mind healthcare and also how you can make healthcare cheaper and accessible. With this, I want your mind in terms of ICU. How can we make ICU cheaper? Because today, if a Kenyan is admitted in ICU for just 2-3 days, they are likely not to pay less than $1 million shillings or 2. It means majority of people will die when they should actually be accessing the necessary health service because of affordability. Finance Bill 2021. That bill exempted laboratory equipments and certain drugs and reagents on page 34 and 35. Maybe you should be aware of that particular bill. But it has since the VAT has been reversed silently. What would that be in terms of the cost on health? Thank you, Chair.
Missy?
Thank you, Chair. And because you had given Gikari a chance to say something about the nominee earlier, I could also maybe start there that when we worked with the nominee during the politics and she didn't make it through the party denied her ticket, ODM was gracious enough and we seconded her to the Kitale National Polytechnic as a NASA sibling. And Chair, I'm saying this because together with the council that she chaired at the National Polytechnic, we were able to get 100 million for that polytechnic through Magoa. Getting 100 million from Magoa, you know, is not a walk in the park. So I think she's capable of doing miracles. But to my question is, this issue of Cuban doctors, there's a complaint on the local doctors that the Cuban get more remuneration and more perks than the local doctors. You're going to reconcile, and especially the formation of Health Service Commission. We have Teacher Service Commission that has been able to take care of interests of the teachers, but the doctors have a need a Health Service Commission so that this issue of Cuban doctors on the street striking in this country is not healthy. I remember, Chair, when I went to a hospital and the doctors were on strike, and he asked me whether I'm a politician. I didn't even answer the question because I didn't know how painful that injection will be. You know, the problem is that all the problems of the country, from the doctors to the teachers, are always blamed on the politician until you can fear going to the doctor when they are on strike. So it must be a health service commission in place.
Ms. Nakhumicha, I'm happy to note that Kericho County, my home county, gave you the first breath. Mine will be a question from someone who is watching this interview, and he's talking about the taxation of medical equipment and medical drugs. Actually, it's a proposal that if you are confirmed by this House, that you get into tax framework so that it becomes an intervention, because with those taxes, high taxes, the price of healthcare increases. So what will be your plan as asked by this person watching us? Thank you.
What was the next? Ferdinand? You forgot?
No, I didn't forget. I'm really keen. Very keen here. Congratulations once more for the appointment. So I think you're doing well. Now, I want to ask you a question, or rather your comment, on the retention of patients and the bodies. Some hospitals, particularly general hospitals, today, as I'm talking to you, I have a body that's been retained for 6 days in the Eldoret because of non-payment of the hospital bill. What do you want to say about that? And of course, there are also patients who are retained for non-payment of the bills. What are you going to do if you're made a minister for health? Thank you.
Thank you. Thank you, Mr. Chairman. The first question, two of them from my constituents. The first question is from one of the nurses who about a year ago was recruited to go to Britain on expatriate basis.
Yes.
Chair, I wanted to seek your indulgence.
Yes.
That issues that relate to my constituency will be dealt with at the health committee level. We need to deal with the global affairs of health now of the country. But if I bring problems of my constituency, Chair, that there's a nurse that was sacked, what can you do about it? Chair.
Sorry, you've not even listened to the question. It concerns everybody. I'm sorry, this recruitment was for the entire country. By the minister.
Sorry, I was consulting with the majority leader.
Yes, let me just ask you, please. Let me have the leeway. I don't think Jeanette has any right whatsoever to interject. When you're going to ask about what, I have the right to do so. So please don't. Thank you, Mr. Chairman.
I have the right to raise a point of order, Chair.
Your right to raise a point of order is legitimate. Let him now ask his
Yes, let me ask you the question, because the person asking is in the constituency, but it's the entire country. Through the Ministry of Labour, a year ago, there was a proposed expatriation of health workers to Britain, UK. That went on, but eventually we are not sure what happened. My question to the nominee is whether if that chance still exists, she will be able to carry it through, or we do not have enough health workers in the country, as a result of which you're going to absorb everybody who has done health practice and professional. Number two.
Only one.
So, because I have two absolutely. Number two, very quickly, universal health care. Through the Ministry of Health, in the year 2020, nurses were contracted and they were given contracts for 3 years in the countrywide. Now, these contracts are coming to an end in June 2023. As nominee Minister for Health, would you consider what to do with these contractees, whether it's to absorb them permanently and pensionable, or it's extension of contracts?
Thank you. Your time is up, so compress your answers.
Thank you, sir. Thank you, Chair. Honorable Shure, whether I'm aware that staff at Kemsa were sent home, and therefore what will I do about it? Honorable Chair, I am aware that reforms are ongoing at Kemsa, and as I sit here as a CS nominee, I do not have full details of the nature of the reforms. Therefore, I would request that if this committee approves of my nomination, that once I get into office, then the matter is looked into. Honorable Raso, you spoke about level 5 and level 6, and what do we do to bring up the other hospitals to this level? As I said earlier, the focus of Kenya Kwanza plan is on primary health care, and therefore we shall be looking to equip more the hospitals at the bottom. And once the hospitals are at the bottom are working, there may be very little need to upscale. And if there is need to upscale in terms of then capacity and the healthcare workforce, we shall work together with the county governments through the intergovernmental sector, so that then we are able to determine which are the ones to be upscaled. And I want to agree with you that in those areas of Marsabit, Wajir, Garissa, there's a lot of work to be done. You asked about the cost of ICU beds and how do we make it affordable. The simple answer would be through ensuring that NHIF is able to cover for this, and therefore we are going to do the RRI that I talked about in terms of recruiting people to be able to be enrolled into the NHIF, hoping that then it covers all this. About the bill that is there, Mheshimiwa Raso, I do not have full details. I'll request that you give me time, and if this committee approves of me, then we can have that discussion. Honorable Caleb, thank you very much for sending my name to being appointed as a member of the council to the Kitale National Polytechnic. And you've asked about the Cuban doctors. This Cuban doctors, it was a short-term contract, and it was a bilateral agreement. Therefore, there are benefits that were to accrue to Kenya and benefits that were to accrue to Cuba. And one of the benefits that was to accrue to Kenya is that then we are able to bridge the skill gap that exists. I am aware that the first cohort of doctors that was sent to Cuba, out of the 50, 47 already graduated, and therefore we have 47 family physicians who are going to be absorbed. So in terms of their remunerations, why Cuban doctors are remunerated more than the local doctors, matters of remuneration are discussed by the county governments when they employ the doctors. But again, I'm aware that there are collective bargaining agreements that have been signed by unions and the county governments. Therefore, for the national government, it's just to ensure that there is collaborations in terms of discussing regarding the remuneration. Honorable Koech, regarding taxation of medical equipment and drugs, I am not a finance expert, and therefore, if this committee approves of me, I'll be working with the CS Treasury to see then on how we work on the tax regimes to ensure that the cost of healthcare then comes down. Mheshimiwa Ferdinand, you have passionately talked about retention of bodies and patients in hospitals due to bill payment. I do not have the magic bullet, but healthcare has to work through NHIF. And therefore, together with the members of this committee and members of the House, whatever it takes to do radical changes to ensure that everyone, and now there's a bill that is mandatory, the listing to NHIF. We have to work together to ensure that that works. So that then the strain on us, the many WhatsApp groups that you are in and I'm in, then we are able to take care of that. Mheshimiwa, the question on expatriation of nurses to the UK and whether that continues or not. This country, training of nurses is being done by very many institutions. I am aware that KMTC only churns out about 3,000 nurses per year. And therefore, I'm not sure that we can absorb them locally, all of them. And if we need to expatriate, I believe we shall be bringing revenue to this country if we expatriate these nurses. So from where I sit, it is something that should continue, so long as we have excess resource, then we should be able to earn revenue from the excess resources. Whether contracts will be renewed or not, every contract must be reviewed on its own merit. If the person has performed well and it merits being renewed, then so be it. If it does not merit, then it will not be renewed. Thank you very much, Chair.
Thank you.
I just want to tell the nominee that she's done extremely well, and that as a Kenyan woman, I'm extremely proud of you.
Thank you very much. Thank you.
Chair,
Yes,
Chair, through you with Chair. That is how, I don't know, this is my boss, but that is totally out of order.
she has heard you.
I'm allowed to be out of order.
Dr. Susan, thank you for your appearance and answering questions. The lack of sufficient interventions as you're answering as a story to tell. You will now have 3 minutes to tell this committee your final wishes.
Thank you very much, Chair. I want to thank your leadership and the honorable committee members for the interactive session that we have had. I want to believe that I've been able to demonstrate my suitability, maybe not at 100%, but to a good extent. and therefore I'll be seeking the indulgence of members that when my issue comes up, that you be my ambassadors in terms of ensuring that then I successfully get to be your CS for Health and we move together. But I also want to take this opportunity to thank His Excellency William Samoei Ruto for living up to his promise of bottom-up. As I sit here, the day my name was mentioned, many people were wondering, who is this Nakhumicha? Whether she's so-and-so's girlfriend, whether she's Chepkati's daughter. But I want to believe that I have been able to demonstrate that I merit for this position. And I am looking forward to serve Kenyans in this position. I want to call upon all of you and to pray to Almighty God that we make a difference in the health of this country. Thank you very much, Chair.
You are released to go back to your other duties. As you do so, the Secretariat will check with you on one or two of your documents. Sergeant, you can show the nominee her way out. Order, honorable members. Order. Order, Mule. The meeting is not over yet, honorable members. Deputy Speaker,